Hi everyone. Today we're going to continue our discussion regarding the appropriate assessment for skilled nursing home residents with the same conversation we have, detecting the change of condition at daily round at a skilled nursing home. As we discussed before, it is very important to understand that one of the major job of all the clinicians in the skilled nursing home is doing assessment, and this assessment is actually going to be on the bedside. And the most important thing, whenever we have change of condition, whenever we have a new admissions coming to a skilled nursing home, it's our job to go to the bedside and evaluate and assess the patient. We discussed about the different type of assessment and we continue to doing it. Today we're going to just quickly remind you how important is the assessment for a skilled nursing home resident, especially the vulnerable one. And again, the most important job of every single nurses at a skilled nursing home is assessment and detecting a change of condition. Detecting the change of condition is the most important things that we need to do. I mean, our daily job as a nurses at a skilled nursing home is really focused on detecting the change of condition. Is not our job is med pass. It's not a job to just reviewing the vital signs. It's just technically the entire picture, which is going to be the change of condition. When it comes to the young population versus old population, it is very important to understand the change of condition can be extremely different. Change of condition in somebody who's old can be very mild or very different, but is in reality, it's actually the change of condition is extreme. And this is so important. To minor change of condition in older adult population, vulnerable, can be a serious change of condition. Let me tell you some example. For example, we're going to discuss further, an older adult person can have a very minor manifestation for having a severe sepsis. But a young patient can have all full spectrum of the symptoms when they're septic. They're both septic, but the older patient is not showing, is not presenting the sepsis as serious as the younger person. And this is one of the major problems. A lot of time when you go to the bedside, you see the residents on the bedside and you look at them and see how they look like, and you don't detect anything. But in reality, is in the older adult population, vulnerable population can be extremely difficult, and it's so important. As I said, again, one of the major conditions is that in elderly patient, especially in the people with dementia, it's going to be so hard to identify. Even like, for example, a change of vital sign that for you, it may not going to be significant. It can be significant in somebody who's vulnerable and also very old. I want to tell you an example, like for example, fever. Fever is one of the very good things that we need to discuss. Due to reason, the reason of the change of the thermoregulation center in the brain, older adult population, they may not have significant fever when they have severe inflammation or severe infection. And fever can be in 20-30% of elderly people can be absolutely absent despite if they have severe infection. That's why when you have an elderly person, for example, has urosepsis, UTI, or pneumonia, or any kind of infection, and you check the temperature and say temperature is fine, it doesn't mean that necessarily the residence is fine. When you report it to the providers or clinician or the doctors at the skilled nursing home, you can't say, doctor, by the way, the patient is doing fine because I didn't detect any fever. You should not rely on the temperature in older adult people. As I said, 20-30% can be absent. The other things that you always remember, fever by definition that you use in younger people is not necessarily going to be the same thing they use in older patients. That's why when you have a just 2 degrees from everyday baseline of the temperature, you can consider that's probably a fever. Like for example, if somebody has always 97, 98, and now today is 900, which is a 2 degree Fahrenheit above of the baseline, that you can consider fever. Is this the mild fever or is a severe fever, you don't know. You really don't know the answer. You have to evaluate and look at the entire picture, because that 2 degree can be considered a severe fever. The other things that is so important to understand is when you have an older person or vulnerable person in a skilled nursing home, some of the other changes that is so important for you to detect. As I said, detecting the change of condition is the job of the nursing in a skilled nursing home. One of the detection, it will be gait and walking. Whenever you see a resident's walking has been changed, they become more slow, more wobbly, more unstable, or even had a fall, they always think about change in balance. It means a change of condition. Now that change of balance, change of the gait can be related to many factors, can be related to neurological problem, can be related to medication that they're taking, can be related to pain. This is something that we need to evaluate. That the next step is your assessment. Assessment about evaluation. Why is that? Is it the pain is detected? Communicating with the providers that I have noticed that, for example, the residence A at this room has more impaired in walking and balance compared of before. And even the family noticed that. This is something that you should not ignore it. This is something that you need to pay attention to it. When it comes to the weakness, it's also very important. Weakness is one of the other serious signs of the change of condition. General weakness, like for example fatigue, and can be a sign of infection, can be a stroke, can be major systemic issue, can be side effect of medication. But overall, if I have a resident that is more weak than yesterday, is more weak than last week, is more weak than 48 hours ago, and especially extremely fatigued, that can be a major problem. I need to do assessment. An assessment means head to toe assessment, looking at the patient, the resident, looking at the medications, looking at any new medications that has been prescribed, and look at the other vital signs can be extremely helpful. The other things is changing the urine pattern. For example, if somebody has a new onset of urine condition, incontinence, especially incontinence, that never had before, it doesn't mean that we should ignore it. It can be stroke. It can be UTI, new infection. It can be a sign of retention because they have a bladder, it started to retain the urine and then suddenly going to release it. That can be obstruction, can be something caused the urine retention, can be the medication that the doctors at skilled nursing home prescribe and causes the urine retention. That's why suddenly the resident has a urine incontinence. And then that's so important because if somebody has obstruction and has the urine retention, that can cause post-renal failure, which means that it can cause the renal failure, it can damage the kidney, it can be permanent damage to the kidney, and that needs to be addressed right away. That's why even change in the urine pattern detection is so important. The other part, which is so simple, the change of bowel movement, we never think about it. That it can be a situation. Like for example, if somebody comes with a constipation, a lot of us thinking about constipation because not drinking water, maybe because we give the medication to the patient, to resident. Yeah, that's true. That can be the cause. But we're talking about more serious problem. Constipation, fecal impaction can be a sign of obstruction. This is why when it comes to the evaluation or assessment, it is important to look at the resident to see if the patient has more weakness. We can touch the belly, we can see the belly. If the belly is distended, if the belly is more tender, that is probably something else is going on. It's just not a simple constipation because the person hasn't eaten fiber, hasn't eaten water, or is less hydrated. Or maybe resident says, I try to drink water, but it doesn't go. Or the family members sometimes notice it that, we gave a lot of fluid when we were there, but it seems he's really can't go. And especially that's very hard because constipation in people with a cognitive impairment, it's going to be extremely hard to be detected. And that's why the coordination between you and CNA, it's so important. If the CNA reporting to you, or you look at the CNA report to see that the resident hasn't had a bowel movement for days, that is another change of condition. That needs to be addressed, that needs to be communicated, that needs to be evaluated. The fecal impaction can increase risk of always urine infection, and that's something we need to remember. Anytime the colon is stuck with the stool, it's pressing the bladder, is not let the bladder to be empty, and that causes urine retention and cause the UTI. And again, diarrhea also can be a sign of impaction. Why is that? Because when we have obstruction, is a partial obstruction, a part of the obstruction is open. That's why the stool behind the obstruction will be very liquidy and it can pass as diarrhea. That's why if somebody has a diarrhea, it doesn't mean that person has no obstruction. No, can be sign of obstruction, a partial obstruction. Skin, and skin. How important is that we open the gown of the residents and look at the skin. Rash, it's one of the scariest symptoms that we can see in a skilled nursing home. Can be related to infection, can be sepsis, can be drug reaction, especially we need to pay attention. If there's a drug is on the list, and if you don't know, if the nurses or providers, they don't know, we always have pharmacists that they can consult for us and see if one of the drug is causing this rash. Dryness of the skin, dry lip can be sign of the dehydration. That's why when you look at the skin, even like a cracked lip, it's something that you need to look at it, and if you have it, you think about that's possible dehydration. When we talk about behavioral and neurological symptoms, that's one of the other things we need to detect. If the resident is more confused, agitated, or if the social interaction of the residents has been changed, demeanor, speech, appetite, these are the very, very important signs that if you see in a residence, that means we are dealing with a change of condition. Again, I'm repeating again. If the residence is more confused than yesterday, is more agitated, a lot of people think agitation is only a psych symptoms and is related because the person is unhappy. It can be a sign of the systemic disease. Agitation can be a sign of infection, can be a urine infection, can be a fecal impaction, can be an adverse drug reaction to a medication. That's why the residence is very agitated, especially the people with cognitive impairment and dementia. If someone has less social interaction than before, means there's definitely a change of condition. The speech of the residents has been changed. Their articulation has been changed. That is important. Appetite. When the residents is not eating, is not only psychological, it can be a sign of the systemic problem, and that needs to be addressed very well. The key point at the end is that do not think the vital sign is the only indicator of the change of condition. This is one of the wrong things that we do. Whenever we have change of condition, we always rely on only blood pressure, heart rate, oxygen saturation response. That's very important. We need to do that. But it doesn't mean the vital signs. When it's stable, means that there's no change of condition. No. It can be neurological, as I said. It can be constipation. It can be urine. It can be many other factors that is all related. And don't forget, the older patients, again, they have very atypical presentation. Always rely on your assessment and collect the data as much as possible. This is the key point of our service today. It's so important to remember. I know we're going to talk more and more details about every single of them, but I just wanted to remind you about how important is change of condition and what your job is detecting of the change of condition, and then the next step will do assessment. Please feel free to email me if you have any question, and thanks for all your work that you do. Thank you.